As you can see here, very deep nasolabial fold. And look to the skin itself. There is some wrinkles in this area. And it's interesting to see the vein. And you can see here the transparency of the vein. So I have to take really care about these veins and this very superficial vascularization not to get bruises. I'm going to give her a volume with the cannula and with one puncture to give her more volume in this side and to lift the nasolabial fold. So indirectly, when you give volume in this region, you get more good effect of the nasolabial fold. You can make the puncture from the nasolabial fold from the inferior part here. I talked about the vascularization. So the facial artery is coming from this side, going up, giving the angular artery, and just close to the nose, going up in this region. So I will make the injection with cannula. I will give her some volume in the malar region. There is a puncture, as you can see. If you are in the right plan, it's very, very easy to go in the subcutaneous region. And you can progress without force, easily, and keep a certain distance to the skin, deep, just keeping the direction as you have seen in the fat and down posterior to the skin itself. So you can see the shape of the cannula. Give me the point. Yes. I insert the cannula. For safety, just a little bit pull back the plunger to be sure that everything is all right. Very slow injection, retro tracing injection. And on the cannula, you can see the graduation. It's 4 or 5 centimeters long. Change the direction. Go just a little bit down. Very slow retro tracing injection. And you see the top of the cannula. It's the distance between the nasal, the nose and the injection about 1.5 centimeter. Why? Because you have the vessels in this region. That we can call a fan technique. I move all the time, and even the needle. If I use the needle, I move the needle. I never do static injection to avoid to injure any vessel and to make intravasal injection. You can mold a little bit. We lifted the nasolabial fold and we reduce the deepness of the nasolabial. I don't need to make any nasolabial injection anymore. So it will be okay like this.